Hello and welcome to Tech Report on Sky News Business. Well, Australian miners have long been the darlings of investors, but this year could mark the arrival of a new sweetheart sector. Aussie tech companies and small cap companies certainly getting a lot of attention as a potential growth spot. On that note, Global Health Limited could be one to watch with its portfolio of applications built for the healthcare industry. Well, here to tell us a bit more about the company is the CEO, Mathew Cherian. Thank you so much for joining us. Just firstly, tell us what you offer. What does Global Health do?
Thanks, Bridie. Thanks for having us on. Well, Global Health is in the business of writing software for the healthcare industry. So we just do apps for the healthcare industry. We probably had our origins about in the mid-80s in Perth, where we did a lot of fee-for-service consulting. But in the 90s, we got a bit more involved and built a bit of a niche in the hospital sector. And when the internet came on, we realized that this is a sector that really could well do with some of the benefits of the internet. So over the last 10 years, we've transitioned out of the fee-for-service side and the non-health industry. And today we've got quite an extensive portfolio of applications that's across health.
And where are those? Where do you sort of focus most? Is it mostly on sort of hospitals or...?
No, so we've taken the view, and the global part of our name is really about taking a holistic view of health. And so we've kind of tried to look at it from the patient's perspective, what we call the patient journey. So it's probably best explained if you think about what we go through as consumers every day. We present to the GP, and the GP might send us for some test, give us a piece of paper. The test results come back, and then we get referred to a specialist who might do more tests on us. And then we might get admitted to a hospital, and after we get discharged, yet more referrals go out to allied health people like physios and so on. So that whole patient journey in a single episode generally involves about 12 small businesses. You know, the physio, the GP, the specialist, they're all individuals. So by taking a holistic view of health, we're trying to streamline, all the administrative overhead that goes with that paper flow. There's about 1 billion pieces of paper that flow through health every year.
So I guess, something that we do talk a lot with the rise of big data, how do you protect patient privacy, and what are the risks of losing that sort of crucial data?
Well, the government's been pretty proactive in sort of enforcing standards for how you can communicate across the sector, and we're one of 3 or 4 companies that are certified to sort of send clinical data, sensitive clinical data, securely across the net. But our applications are all across health, so in hospitals and in the non-acute sector, particularly in mental health, and we're sort of driven by connecting the whole sector and empowering the patient a little bit more.
I guess, too, we've been seeing the government, well, certainly through Medicare, trying to get people to sign up to e-health, as it's called, to sign up for these electronic health records. Do you need to, make sure your systems work with that, talk to that? Is that something you need to be mindful of? Or?
We tend to be driven by what our customers ask us to do. And the current focus on the Medicare personal health record tends to be very much around GP systems. And so we certainly are working on connecting to the government system, but we haven't had a lot of clients that really have asked for it. Yeah. And obviously in business, the people you listen to you're very much customer driven. Yeah.
I guess, what are your plans for 2014 then? How are you wanting to grow the business? Where's the next sort of stage of growth coming from?
Well, we had a really good year last year, and it seems that the confidence is returning back to the businesses in general, and we've had a lot of demand in the area of mental health systems. That's primarily because that's where governments and employers are starting to realize the incredible cost and productivity that mental health has on the economy. So that's an area of growth for us. And in the coming 18 months, we're working with a couple of clients on just streamlining the patient journey. That little example that I gave you about where we're trying to sort of make the patient experience and the clinicians that are involved in your care all work a lot better together rather than the way it currently happens. There's about a 30% overhead in administrative costs and health. So it's quite ripe for some serious value.
And as we mentioned in the introduction, obviously this sort of seen as one, area of growth potentially for the market. Obviously last year shares hit, I think it was about 2.5 cents the low, but obviously they've had quite a rise off that. Where do you want to see the share price, and how do you think it's sort of been unfairly treated by investors, up to that point?
I wouldn't say unfairly. I mean, I think
medical tech sector as such.
Well, no, to be fair, investors make their calls based on your results. So,
yes.
The main thing that we have to do is keep making sure that we grow earnings. We're fortunate in that as we transitioned out of the fee-for-service business model into annual license subscriptions, about 80% of our revenue is recurring. And with that recurring revenue now, we've kind of hit the tipping point. And so now our focus going forward is very much about how do we access the global marketplace. And if we keep doing that and keep growing our earnings, then eventually the market's going to recognize us.
Yeah. Where would you like to see the share price?
Well, I think we're trading at about 10 times historical earnings, and we've announced to the market in November that we expect our earnings per share to grow by 25% this year. So we'd like to see our share price, more consistent with where the rest of the market is in general, and in particular in tech stocks. But the market's the market.
Absolutely. Look, thank you so much for coming in and chatting to us today.